The Namibian newspaper recently visited nurses in Windhoek hospitals to take a look into how they have been coping during the Covid-19 third wave.
We've never experienced in a lifetime to say that where we can see running out of beds, that we do not have beds to accommodate these patients at all.
I always believe that, God will provide. So He will not give us this certain situations that we cannot, overcome. It's really difficult seeing these patients died on your watch,
It's like we got so relaxed at the second wave when we saw the number coming down and everything. And as a country, we kind of relaxed and not really adhering to the rules until this third one hit us so hard that we don't even have a direction. So the numbers are really, they're escalating, it's like every day. And the death toll is so high.
There's basically nothing more that you can do. You give the patient everything, the 100% oxygen, all the medication you can, but still at the end of the day they don't really make it, or there's just that you just don't get around it.
COVID ICU has been full. I actually had to swap out the patient in bed too because she's been there for so long. She's 18 days. She's not infectious anymore. And I had to take over quite a young patient. So we had to do a swap in order to find a bed. And it was stressful.
It's heartbreaking knowing that you welcome the person, you receive the person, and then after a few hours, or let's say after a day or two, to hear that that person is dead, it's heartbreaking, and then you feel like you failed on the patient, even though that's not really the case always, but there is that feeling of failure. At Catholic Hospital, we try to work together, teamwork. We encourage our staff to work together because it's only together that you can deal with this. Alone it's impossible.
Yeah. Fortunately, we had the opportunity to provide the vaccines to our staff before this wave hit us. So what we did during the first wave, there was no vaccine. So 64 staff members became sick. And during the second wave, another 24 came sick. But the third wave, I'm fortunate to say, and I'm really proud because we are having a herd immunity, not fully vaccinated. 71.4% of our staff got the first shot already, which I think was good. Some of them didn't like it, but we tried to encourage them the whole time. Let's create a safe environment for yourself and for us around here. And I think this is what we see.
The third wave was terrible, I must say that. Off-guard. It let us really off-guard this time. I can really say that the third wave was like a surprise to us. We didn't expect that it will hit so hard. And yes, prepared, we were prepared, but not prepared for a wave like that. It will hit us. And it really affected everything. What I mean with that is it affects the oxygen levels of the hospital. The oxygen levels went down because now a lot of patients went on what we call a CPAP. Most of them, no one was not on oxygen this time. Everyone was on oxygen. The oxygen levels dropped because we got an oxygen plant. If we come to staff, the staff were also affected because now they are sick. Some of them are sick. Some of them, the children are sick, they cannot come to work. Which means now you have to pull, where you can pull and bring in. It was really tough, this third wave. And then the death, it affected also a lot. Because now some of the relatives of the staff also passed on. And you cannot tell a person that, no, you must come on duty. Of course, she have to mourn.